Okay, I think we'll go ahead and get started. So good afternoon, everybody. Again, my name is Karen Lee Harrington, and I am with the Maine Health Data Organization. And I want to welcome you to our webinar this afternoon, where we want to discuss the 3 new healthcare quality reporting requirements that will go into effect July 1. The Maine Health Data Organization is the agency responsible for this requirement, and we'll walk through some information this afternoon. And if folks have questions, please go ahead and submit those via the chat function, and we'll address as many questions as we can on the call. And those that we can't answer verbally, we'll get back to you in writing. And again, we will post a recording of this webinar and the documentation on the website for folks to access. Okay, so there are a couple of folks on the call that are here to support this conversation, and I'll be turning the presentation over to one of those individuals shortly, who will talk about the specifics regarding NHSN. And then there may be others that jump in to help answer specific questions that people have. So just quickly, we'll do a quick overview of who MHDO is. We'll review the new reporting requirements as defined in our Rule Chapter 270, the protocol for the collection, the process for data submission. And then if time allows, I just want to remind folks quickly of the Maine Infection Prevention Forum website. And again, most important, we want to be responsive to your questions. We can go to the next slide. So just quickly, for those of you that are not familiar with the Maine Health Data Organization, we are the state agency that is responsible for the collection, secure storage, management, and authorized release of healthcare data and information per Title 22, Chapter 1683. There are 13 agency rules that support the requirements in statute, and one of those rules is Rule Chapter 270. The name of that rule is Uniform Reporting System for Healthcare Quality Data Sets. Data that's submitted to MHDO includes claims data from payers, hospital data, inpatient and outpatient encounter data, quality data. We receive pharmacy data from wholesale manufacturers, pharmacy benefit managers, and did I say wholesale manufacturers? I meant manufacturers and wholesale distributors. We also collect hospital financial and provider organizational data, and new beginning in July, we're collecting some nursing facility quality data under Chapter 270. We maintain over 1 billion healthcare records, and every month that number increases as we collect new data. Next slide. So just to close the loop, not only are we a data collection organization, but we're also required in statute to use that data for various public reporting requirements that are in statute. And if anybody's interested in that, we can certainly talk about that offline. So Rule Chapter 270 defines the healthcare quality data sets and the provisions for filing the data sets to the Maine Health Data Organization. And you'll see that the provisions include the identification of the organizations required to report, the establishment of requirements for the content of the reporting, the standards for the data reported, and then an overview of the compliance provisions. Next slide. So the new data elements that we're talking about today are defined in Section 2 of Chapter 270, A and B. And so what you see on this slide is a basically cut and paste from the rule. So the first measure is for all patients identified as eligible cases in the specific denominator and numerator categories minus exclusions specified by NHSN. Each hospital or their agent shall report data to NHSN for the following healthcare-associated infection quality metrics in accordance with NHSN specifications. So the first one we refer to as HAI 6. the catheter-associated urinary tract infection rates for adults and pediatric patients, and you'll see in what units. And you'll also see that it says beginning, and January 1, 2020 has been crossed out, and a new date of July 1, 2023 has been inserted. If you go look at the rule, you will see the date of January 1, 2020. That date was extended. The board of directors, which is the governance for the agency, made the decision to suspend enforcement of this requirement due to the pandemic. So that's why the rule says 2020, but what we will actually start enforcing is this requirement beginning with in July 1 of 2023. And you'll see we refer to the measure steward for this requirement as NHSN. And 2B, I won't read the first part of it, but same situation where if you look in the rule, you'll see a date of effective date of January 1, 2020, and that is not the date. The effective date of this is July 1 of 2023. And it's for HAI 7 and 8, which is the surgical site infection rate for patients undergoing inpatient knee procedures and hip. And again, the measure steward is NHSN. And I just want to say for a minute for folks on this call that are not familiar with MHDO, years ago, we were much more deliberate and explicit that in our work that we did not want hospitals or payers to have to submit data multiple times. So if there is an entity that you're submitting data to, like NHSN, and we can go access that data, then we'll go get it from NHSN versus having you have to submit data to NHSN and then MHDO. So trying to minimize the administrative burden. We know you're all very, very, very busy. Anyways, so we'll talk about how you authorize us to access the data within NHSN in a few minutes. Next slide. So the data collection, as I said, begins on July 1 of 2023, and the data collected during each calendar quarter shall be submitted no later than the 15th day of the 5th month following the end of each quarter. And so again, for those of you that are familiar with reporting to us, it's consistent with all the other things that you report. The one thing I will say is that although you can submit this data as just described, we do encourage facilities that if you want to submit monthly, it just makes things, from our experience working with facilities, it's sometimes easier to do it monthly. Next slide. So this is just, again, a snapshot of when the first quarter's worth of data, which would be for the months of January, February, March, when that's due, second quarter, third, fourth. So you'll see the July, this goes into effect July 1. So for the third quarter, July, August, and September data, that will all need to be within NHSN no later than February 15th of, I can't even believe I'm going to say this, 2024. Next slide. Okay, so this is just teeing up what the rule requires regarding MHDO's access to your data in NHSN. And so you'll see in Chapter 270, Section 2H describes the requirement that each facility shall authorize the MHDO to have access to this data. And then 2G, and I thought that this was just important to bring to your attention, is that not only does MHDO have access to this data or authorization to access this data, but the main CDC also has, under our rule, the authorization to access this data. And what I'm going to turn over to my colleague from USM in a second. She'll walk through slides 10 through 14, which provide the instructions on how to confer new rights. Facilities will have to confer new rights to the group in NHSN. And you'll see the name of the group, MHDO Quality Data, and the ID number is there so that we can go in and access these data. And so with that, I'm going to turn this over to Catherine, who will walk us through the next several slides.
Okay. Hi there. So my name is Catherine, and I'm one of the people at USM that help manage the quality group for MHDO. And so I'm just going to show some slide shots of what this will look like. Many of you have probably already conferred rights. You are all already in the group. So when I update this, I'm going to be doing that July 1st. So next week, when you log into NHSN, there's going to be a little flag saying that there's new rights or new defined rights. So you're just going to click on our group here, like this slide, and go to the next one. And really all you have to do is accept. You are able to edit some of these selections, but I'm already going to set them exactly as they need to be. So you don't have to select or unselect everything. If you have questions or you're not sure if it looks right on your end, just let me know and I can walk through it with you. So next slide, Kate. So this is what it's going to look like. So I'm going to be selecting those 3 pieces. So the CODI, the surgical site infections, which are the hip and the knee. So you're going to see all these up here with the locations that are included in that. So this is what the screen will look like. Next slide. Just more of this. Again, you can go in and select and unselect stuff, but it will already be set up, so you don't have to do any of that. Next slide. And then this is the final piece of conferring rights. So you can just hit the accept button, and then that will notify us on our end that you've conferred all the rights that we requested. So, and that's it.
Sorry about that. I need to take myself off mute. So thank you, Catherine. So this next slide, again, is just a summary of the measures and the specifications and where within NHSN you can find the specific guidance for each of these measures. So before we transition to talking about Maine's Infection Prevention Forum website, I know that was a lot of information in a short amount of time, but again, we are very sensitive to the fact that you guys are all wearing multiple hats and very busy. So we will post all of this and we're happy to work with people offline if we can help in any way as you're going in and conferring rights in NHSN. Are there any specific questions based on what we've quickly walked through this afternoon? And it's a small enough group that if you just want to unmute yourself, that's fine. Or if you want to submit a question in chat, that's fine too. Okay, so I don't see that anybody's trying to, Kate, am I missing anything? I don't think that anybody's trying to unmute or raise their hand.
No, I don't see anything.
Okay, so let's move on to the Maine Infection Prevention Forum website. And Kate, where we have just a few minutes, it would be great if we could actually go to this website, but essentially the content on this site is it includes the latest infection prevention courses and resources for healthcare and direct care professionals. It's developed and supported by the Maine CDC, the Maine Quality Forum, which is the other agency I work with, and the University of Southern Maine. The top 3 reasons why we see people registering for our core training is it helps with increased knowledge and some of the requirements that folks have with some of their own internal educational type requirements. There is technically no CEUs, or I think that's how you refer to them, continuing education credits that are tied to this yet, but I am working on that. So we'll circle back with you all if we can make that happen. But we've had close to 800 healthcare professionals over the last several years register for our core infection preventionist online training program. And they represent over about 150 facilities in the state. So, I think for a lot of that, it's been more the facilities like nursing homes or maybe home health care, where they may not have as many resources as the hospitals may have relative to infection prevention. But just wanted, again, to raise awareness that this information's out there. And we now have a whole section of the website dedicated to Project First Line, which is a federal CDC program where we've tried to capture all of the information that they've put out there, as well as other information regarding this initiative in this site, so that it's sort of one-stop shopping, if that's helpful. And you'll see when you scroll down, you'll see the highlighted modules. So the core training that I was referring to is an 8-hour course training. We've got a new training, which again is more specific for long-term care facilities on UTIs. But if you're interested in looking at, what we're out there talking about with nursing homes, take a look at that. And there's some other courses around biological hazards and bloodborne pathogens. So again, just more wanted to raise awareness if folks weren't familiar with this resource. And I think unless there are any other questions, we are approaching the end of this webinar. If you have any questions around compliance or just general questions, Kimberly Bonsant, who is our compliance officer for this work and is also our technical guru, is available, and you'll see her contact information follows. And then if you've got questions regarding NHSN instructions to join the group and or confer rights, there is a link to information on how to get that going. And again, we'll post this information on the site. I'm hoping we can do that before the end of the week. And I think with that, if there are no questions, we'll let folks get back to their